Thank you, Dr. Davanzo, for a really thought-provoking and challenging talk, or topic that's very challenging, but really interesting in an area that needs to be investigated further. For the people that weren't here today, could you summarize your talk and about making the first hours safer and promoting breastfeeding?
Yes, we should understand that while promoting breastfeeding and skin-to-skin contact, that is really facilitate breastfeeding in the first hours of life, we should implement procedures that are safe, because some babies are prone to an adverse event that is called neonatal collapse, and luckily it's rare but could happen, and if it happens it's hardly accepted by everyone. I mean health professional as well as obviously parents. If we go deeper in the knowledge of neonatal collapse, we can understand that there are some risk factors, and we can modify at least some risk factors. Not obviously the vulnerable part of the baby, but the risk factors certainly, yes, we can modify. And one risk factor is an asphyxiating position. That means that the baby is put prone on the belly or on the thorax of the mother, on the chest of the mother, but in an asphyxiating position. That means that mouth and nose are not patent. So it's a risky situation because it could have difficulties in breathing properly. Another risk factor is lack of supervision, and that's mean also staffing, because you need a certain number of health professionals to be ready to check the baby. But as staff is limited worldwide, particularly in Italy, we have decided to prepare a checklist to orientate the control on the part of the health professionals. But it is only one intervention. There is another intervention that is parents' information. Apart on the physiology of delivery, they should have information of what happened in the first few hours after birth, and the importance of skin-to-skin contact, but also the safety procedure for the skin-to-skin contact.
So what are the challenges that you face maybe in Italy, or you've heard of in other countries as well, in implementing safe practices in the first few hours, or even skin-to-skin practices in the first few hours? What are the challenges you're facing, and how do you see to overcome them?
Yes, the challenge is that sometimes mother is alone, and sometimes there is an emergent condition to face, and obviously the baby is separated by the mother because you have to make a choice. But this happens luckily in a limited number of cases. In the remaining condition, you should check the baby, and with the help and with the contribution of parents that are there in the delivery room. But sometimes we must admit, they are distracted by telephone call, sending mobile phone messages, and not really taking profit of an extraordinary moment that is that moment immediately after birth, that is very sensitive to make the bond between mother and the baby, or parents and the baby, very important, extraordinary.
So you spoke of this being a paradox, that skin-to-skin care is so important, but also being vigilant and watching the mother and health professionals being there. Is that your key message to take away from your presentation today, is just being aware that this is an issue in the first few hours? Do you have a particular key message you'd like everyone to take home?
Yes. If I should send a message to health professionals and to breastfeeding promoters, is to do their best to match the good neonatological practice according to the available evidence with the promotion of breastfeeding. And both parts, breastfeeding promotion and neonatological practice, should know each other, should recognize each other. There is no need to have a duel about this topic. The common interest is the health of the baby and the mother, and obviously there is no contradiction about a safe management of the baby and breastfeeding promotion. There should be a contradiction.
Definitely, it makes sense. And so, what's next for you in this area of research, or another exciting area? What's the next area for you?
In this area, we need data on the effectiveness of this intervention. I mean, the using of checklists in the first hours after birth, because at the moment we can intend the use of this checklist only as a best practice. We have no evidence that is function, but we cannot do something that makes sense and that make every health professional comfortable, and giving the conviction that they have made their best in trying to reduce the risk. Because if it happens something like neonatal collapse, you feel guilty usually, even if it's not your fault. So this is directly, obviously, towards reducing neonatal collapse, but give also a sense of security to health professionals.
We look forward to the data
Okay.
and the recommendations. Thank you very much.
Thank you.